we're doing data science and COVID today on our ECVX and expert talk. Our panelists today are Derrick VanGennep, physicist, website editor, and data science lead for our team at incoronavirus.org, and Dr. Shakuntala Choudhury, PhD, who teaches data science. So welcome everyone, and we can get started with the term PowerPoint that you two have worked on, kind of get the ball rolling, and then we'll go into discussion of data science and COVID.
Sounds good.
So I will give them, honor to Derrick. He's the Nexi data science leader. So
we have a quick PowerPoint. Shakuntala is going to talk to us a little bit about data science in general, and then at the end, I'll chat about COVID-specific data and some of the stuff that ECV works on, and then most of our time, I think, will be spent just chatting. So if anybody has any questions, feel free to put them in the chat. Okay, Shakuntala, it's all yours.
Yeah, thank you all for coming on a Thursday night at 8 Eastern, 5 p.m. West. Thanks for your time, and we look forward to talking about data science, where you can develop a leadership capability to combat COVID using data science approach. So I joined coronavirus in May, and this has been a pretty fulfilling month. I brought my team of students and other people to the group, and everybody's enjoying. It's a good forum, very well respected. So thanks for having me here today to talk about data science.
All right, let's get into it.
So what is data science? People get really confused sometimes. So I want to bring the difference between what is statistics and what is data science. Statistics is based on data and formulation. It's used for reasoning the mathematical validity of models. Data science, on the other hand, is the scientific way of looking at data. It's more than statistics. It's an interdisciplinary function where people from physics, computer science, statistics, psychology, even human factors are involved to develop algorithms. So the machine, which will take a huge chunk of data and process it, because we are in an age of big data, and big data are huge volumes of unrecognized data, often from number of sources and not able to be processed using the traditional, ways or calculating the formula through statistics. So a combination of statistics, computer science, and mathematics. Machine learning is a catch-all term to describe the process by which an algorithm learns and makes prediction. And generally, before we do any machine learning, getting the data organized, which is the data mining or data exploratory process, is very tedious. You have to be very good at collecting data from the web by web scraping. I know a lot of languages like Python, SQL, etc. to pull the data, because data, unless you use Kaggle or GitHub, data would not come in a very clean format. In Kaggle, you can get in CSV file and read it in. So data mining and data exploratory data analysis are key. That takes about 40 to 50% of the time, and then you define the models. The models could be different kinds: supervised learning, like regression and classification; pattern recognition, which is more of a computer science discipline; unsupervised learning, like clustering, where homogeneous group of people are kind of looked at as apple and oranges. For example, in cybersecurity, people would look for patterns of cyber crimers. And in that case, it may not be a model, it could be a cluster. And you look at the mean and the variance, the
I've
dispersion.
a lost audio there. Can
You
we?
cannot hear me?
Okay, I can hear you now.
Oh, so statistical techniques are very important because it gives the basis of reasoning. So what is data science? Data science is, in a nutshell, combination of statistical or mathematical reasoning, statistical computing, and business domain. You have to know the domain, whether it's healthcare, telecommunications, education, retail, or so on. So you know which models to apply in what discipline. So a common application of machine learning, data science, because people get confused. So I just wanted to show, for example, the chart on here shows the field of medicine that we are involved with right now, COVID. So this gives you early detection. For example, they're looking at the Doppler to see if there's clot in your left or right leg. And that clot could be formed by COVID complication and so on. So with that kind of mechanism and data being fed into computers after the human thought process can detect the early onset of the disease or could be prevented by giving them different response, medication or, to finish, to take care of the blood clots so it doesn't go into the lungs or the brain. Then we have proactive management. Here is fraud detection, the self-driving cars like Tesla, and so on and so forth. And even looking at people and persona. So everything is very statistically designed. So I'm talking about the 5 habits of highly effective data scientists or statisticians, which is like Stephen Covey, the book on highly effective people. So my thoughts are about the 7 steps in effective data mining are as follows: defining the objective, gathering the data, preparing data for modeling, and selecting, preparing the variable. This part is very, very crucial. We need thought leadership, and I thank Derrick for providing that to the team, which included Niloy, Victor, Jamie Durgaitis, and Vatsal. So thank you, team. And then we processed the data and started building the model. And then you have to validate the model and finally implement. So machine learning is a synergistic exercise between man and machine. Right now in the field of retail, telecom, we're huge advantage because these have been proven, but it's a new field in healthcare and pharmaceuticals. And with terabytes, megabytes, petabytes of data coming from the vaccine planning, it will be even more important, especially in the supply chain area, because the vaccines have to be delivered on time. Somebody has to take the vaccine day 1, again on day 31, and it has to be stored in very cold temperature. So the supply chain has been disrupted already with PPE. Now with vaccine planning and all, more robust statistical procedures will be needed to predict what causes, safe delivery on time for the vaccines. And I'm presenting this for people around the world. So right now, Derrick will talk about trends and explain and look at the world from a bird's eye view. Thank you. Oh, it's not the one. Derrick, you can share yours.
Sure. 1 second. Okay, can you guys see this?
Yep.
Cool. I'll just leave it in this view for now. I think all the text is sort of big enough. I just wanted to really quickly go over a few of the important metrics for sort of tracking the global situation as far as COVID goes. And so I think the most important thing is confirmed cases per day. So here you can see a plot. This I took from a website called Our World in Data. They have a nice user interface to compare all sorts of countries with different metrics. And here you can see India is way up high. They're at almost 100,000 new cases per day, which is very worrying. they're also, yeah, they're really struggling to contain COVID, as most of the world is. So I think if you're going to choose one metric to look at, daily new cases is the one. And different countries report this in different ways, but it usually just means a positive PCR test. PCR is like a biological test to see if there's any of the RNA from the virus in whatever sample they collect, usually like a nasal swab or some saliva or something. I think maybe the next most important will be daily deaths. And there's a decent amount of correlation between the cases and deaths. If you remembered what the US curve looked like before, we had sort of two peaks, which is in cases, which is what we see here for deaths. But they often diverge, so they give you somewhat different information. India right now has taken the lead in daily new COVID deaths, and it doesn't seem like it's slowing down at all. So India is a very worrying spot right now. Let's see. One thing that we do on the ECV website, which we sort of borrowed from COVID tracking project, is you can't look at any one metric to get an idea, like the full picture of what's going on in terms of COVID. And so I sort of like these diagrams like this, where I have cases here on the left. You hear a lot in the news, I'm sure, about, oh, cases are increasing just because tests are increasing. So it's useful to show like the daily tests that are going on also. Daily positive rate, this is reported in a different way, basically like every country and every state. There's really no universal standard right now that everybody's following. Currently hospitalized is an important metric, of course. It really reflects the burden on your medical system, essentially. And then daily new deaths is something we already talked about. So I think that's it for my intro. We have, I think, just two more slides here. One is just to point out that there are really a lot of good COVID data websites out there. And so this is showing a map from Johns Hopkins University, where they sort of plot or show these like little bubbles for the number of new cases in each region. And I think that's about it. Shakuntala, does that?
Yes. And then it's very sad to report that as of today, 200,000 deaths in US, which account for 21% of the death in the whole world. And we are an advanced country in education and medicine, so something has to be done. Yeah, some of our work got published in ResearchGate.org as well as in coronavirus, especially look at the page on schools and mask laws.
Yes, on our website, ncoronavirus.org, you can find all sorts of different data. So I think that's for our intro, but we're happy to take questions and
discussions, brainstorming.
Yeah, we'll chat with Gio.
Yeah, so I guess the first thing to ask is, what has COVID looked like from the data science perspective? Since you, Derrick, especially have sort of been here from the beginning and have been running the website and the data science side of the website, what has the unfolding of COVID looked like from your perspective, which may be different than some of the rest of us?
It's some countries are doing not so bad, and some countries are really doing bad. I don't know. So as for data science, so maybe Shakuntala would be better to answer that. But one thing that I've really noticed is since COVID came along, it's sort of in this field of infectious disease and epidemiology, but really people from every field jumped in and helped. And some people did more hurting than helping it, but I think a lot of people really helped a lot. And I think the data scientists have really stepped up with so much COVID data coming from all over the world, like gathering it and figuring out what's going on is really a huge project.
Yeah, in some cases it's 95% of the time, like, India and all, where data is not reported, in China where it's censored to get the good data. So this is an age where web-based service is flourishing because of the COVID. So petabytes of data are being generated every day. And there's a lot of need for data processing, especially like Derrick mentioned, getting the data out of the websites, and this needs special skills. So the demand is so much, and there's the less supply right now with people with experience. So there's a good field. If anybody wants to do projects, they should help out with Derrick and this company and coronavirus, and that is a live project which can be published in the GitHub or Kaggle. People get visibility, and also with some other members here, we are going into hackathons. So that gives publicity and ideas how we can improve.
Yeah, one thing about COVID and the data, like if you don't have the data, you don't know what's going on. And so gathering and presenting the data in a reasonable way is super important. Otherwise, you're just in the dark. And for like some countries might do okay if they're in the dark. Like China, really early on, it was a new disease, and they didn't know how it was transmitted primarily, and they didn't know how deadly it was, and so they took a ton of like really drastic measures to make sure this does not spread. And a lot of other countries did the exact same thing. Every country sort of took different measures in different ways, but for the most part, early on when the data just wasn't there, and even now there's still data that we'd like to know, but we don't have, the countries that took a lot of precaution seem to do well so far.
Especially where there is no travel. For example, all the countries that are successful are like island nations, Taiwan, New Zealand, so on and so forth. Maybe that's another, aspect. Travel is spreading the disease. So that's why schools are closed. So children don't go to school and bring it back to the community. So that could have been, but in US, some of the policies were started late. So we kind of missed the boat on the main time to curb the disease at the beginning.
Yeah, many of the, it's easier to contain COVID if you're an island, but there are many non-islands that are really doing well. But yeah, it certainly helps. Like if you're in the US, the first couple of cities that got hit, like Seattle was one of the first cities that had an outbreak, and it didn't get too bad. But New York City had an outbreak, and it got really horrible really quickly. And they locked down, and it really seemed to be too late to avoid much of the suffering. And in New York City alone, something like 1 in 350 people that lived there died from COVID. Yeah, they had really high death rates there, Boston, and it was all because it all started from international travel. I mean, cases have to get there somehow.
So the virus that came to New York came from European way.
I think
and that's a very strong virus compared to the one in India.
Yeah, I don't know if there's, I don't know the evidence out there for the different infectiousness or how well the different strains of the virus reproduce. From what I understand, India took a decent amount of precaution early on and sort of reduced the reproductive number, well, sort of kept it fairly low. So India had this really long, slow start, and it seems to, India still hasn't really flattened things out. Cases still increasing. Most countries have increased, and gone through one or two declines already, but India is one of the only ones where it hasn't done that yet.
Yeah, once they stop the lockdown, people come out, and the population density is very important because that's where they get infected. So density of the population is very high, especially in a disadvantaged population. They live in small quarters, so there's more transmission of the disease. So you can see that across the world.
All right, so we have a question here from Brenna asking, what happens when the data is reported differently based on different standards? For example, when people test multiple times, are they counted as multiple cases? And sort of how do we manage data cleaning? I think is kind of where that question goes. And sort of how do you track metrics between nations would be sort of another part of the frame of that question.
Shakuntala, do you want that one, or do you want me to get that one?
You can get started. I can chime in. It's about testing. Same person tested today, again 2 weeks, and
yeah. So every region will report their data. So there are these organizations that usually like collect data, and so COVID Tracking Project is one of those. John Hopkins also does it, and so they have to sort of ask everybody, okay, what's your data for today, and they usually update it daily. And every region will have their own little nuance. So like the reporting in Florida might be a lot different than reporting in New York, where they might define like positivity different, or they might define a case differently. They might include probable cases. And all of that stuff is of course a mess. And it gets even messier when they change it every once in a while. So in a lot of like the plots on our website or on other websites, you'll see these like giant spikes sometimes, which look really funny. And you know that it's not just like tons of people died that day or something like that. It's usually just they changed the way they reported something, or they had a backlog. There's like a file on somebody's computer that they forgot to upload. Yeah, it's always a bit of a mess. But for the most part, the small details don't usually matter very much, unless, let's say you're talking about positivity, and county says like, okay, we're going to open schools if we're below 2% of our tests showing positive. Then the way they define that is very important. But for the most part, for the big picture things, the little details usually don't matter.
All right, so I guess kind of the topic to go into, I think, might be the data science war that is taking place currently on the internet. And so there's a lot of different ways to frame this. But I think that the best way to frame this is that there's something like two camps, and there's sort of the camp that I would say we were a part of, which is COVID was pretty bad as a disaster on society, but COVID is not actually a bad disease in comparison with the diseases that we could run into. And kind of the takeaway from that is, good God, are we not prepared for bio-warfare? We need to get our shit together. And so, you know, looking at the data, it's in part, you want to track down what has worked, what hasn't, and then figure out why from something like a hypothesis testing standpoint. Like, what can we do to mitigate future diseases? What can we do to stop COVID? And sort of read from the data where to look for solutions. And Then there is the other side of the camp, which is sort of framing that position might be caring about COVID has ruined our economy, and look at all the reasons why trying to do something about COVID is expensive and useless, and look at how not that bad this disease really is, and it's probably not as terrifying as we think, because it is a coronavirus and therefore has some cross immunity with the common cold. And I think the big flaw in that entire frame of perspective is that it is looking at the instance of coronavirus instead of the set of coronavirus, or really the set of disease. So it's a position that can back itself very, very well with the tools of data science, but is all of its ideas are relevant specific only to COVID-19. And if it is right about anything, it is only right about COVID-19. And so it is kind of blind to the entirety of the potential situations that we will face in the future. And so its prescriptions are all high risk and don't actually give us good return, because fundamentally the pandemic is what has damaged our economy, not our reaction to the pandemic. And so we need to start thinking about, well, the frame of data science on COVID, but also disease in general, very, very differently. In the 70s, we might have been able to kind of have well, we're invulnerable to diseases perspective, but in the modern interconnected world, the way that we are, you can't pretend away a disease because we're all on social media. People will start talking about it. So the idea that, if data science shut up about how bad or not bad coronavirus is, then we would all get back to the economy and a few people would die, but it would mostly be old, sick people anyways. So why worry about it too much? It doesn't account for everybody wow, we're getting sick and dying. This is bad. I don't want to be a part of this. You can't solve the problem of a pandemic that way. And that's basically what we're being asked to do by the other camp. Whereas trying to figure out how to prevent a future pandemic, or even how to deal with this pandemic using rudimentary tools, at least for the West, because we haven't faced a real pandemic in 50 to 70 years, is, sort of the precautious approach is the one that will pay dividends in the future. So that's kind of my frame of the data science war. But Derrick, you probably have been watching this more closely than most of the rest of us. What are people saying sort of in opposition to our general position? And what are your thoughts on the data science war?
There's really a lot out there. And if you asked 100 different people, you get 100 different answers about why our position's wrong. And they'll all think that they have data to back them up. And yeah, I think there are some sort of fundamental issues with data that we see. It's not just a COVID thing. Everybody thinks that science is on their side and their data is the right data and their interpretation is the right interpretation. And that's fair. I mean, if they didn't think that, they would change their mind to whatever they thought was right. But
in theory, at least.
Yeah, in theory, hypothesis, I think we had 12 models back at the beginning of the pandemic, 12 models from the University of Wisconsin. I see Jamie nodding there. Yeah, and everyone predicted different, a time period when different people will die. So we are learning about the disease. And one thing it is clear, some of the public policies, for example, we have 22 million people were unemployed because of the pandemic. And people used to get the $600, which was stopped in last month in August. So how are people going to buy the PPE or something to protect against the disease? Those don't cost much, like $10, $15, but people have to have money to do that, and this is the disadvantaged people as well as, unemployed people. So the disease definitely will go up. So that public policy of, not giving the extra or holding up the unemployment because of the old COBOL programming will not help, solve the problems. Data is what data will tell, but when you look at data of the generosity of the government, that's something to be thought about. Now, for example, we have Thomas from Costa Rica. He's not here today. In 1949, after the World War, Costa Rica decided not to have any military. So they don't have any military. That amount is spent on healthcare and other thing, educating the people, developing the human factor, index. So they don't have that many cases because the healthcare is accessible. In New York, New Jersey, there's very bad Obamacare. Like in New Jersey, you cannot buy Obamacare. You have to be in New York. So people are afraid to go to the doctor because it will cost them. At the beginning of the pandemic, people were scared. So something has to be taken care by the government, the local public health authorities, so people get the right treatment or have the resource to buy the PPEs.
I have a question. Can you guys, there's a lot of debate. Sweden is the hot topic, right? Sweden is kind of like the case of, hey, what approach works, right? Can you guys speak to the data and what it's telling us about what's going on there and maybe any actions that have been taken there or maybe how they've changed as well? And maybe that's the nuance of that is not being communicated publicly. Thank you.
Sweden was very well controlled. I didn't have that chart in my presentation, but it was published before in coronavirus. March, April, May, it was very well controlled. They closed the schools. They asked the elderly to stay home, so nobody ventured out. And in Europe, they have socialist medicine. It's all taken care of. And in fact, in Netherlands, the doctors don't get paid until the outcome is the right outcome for the patient. That means the patient is cured. So that's being controlled by the government. So so that way it was well controlled. Unless Derrick want to say something, and maybe one of our student, Jamie, might have some answer.
Let me show a plot while we talk about it.
Yes, maybe that will help.
So, can you guys see my screen?
Yes.
So this plot's all over the internet, and I can add more countries to it to show the point. But I think one of the best arguments against whatever Sweden did, and they did something that sort of was like a little bit herd immunity, but also a little bit mitigation. Yeah, it's sort of like a nuanced case, but they definitely went a different route than almost all of the world, where they chose to take not very drastic measures, and they chose this early on. This was part of their strategy, and what turned out happening was they had a lot of people that died, of course, and there are many countries that have basically barely any deaths per capita. And so if you compare Sweden to some of the most similar countries, you see that its total number of deaths are much higher, maybe a factor of 5 to 10 or so above the similar countries. But there are a lot of countries that also performed badly. So I would consider this a very high number of deaths per capita. But there are a lot of routes to get there. Like the US, I think, might now be above Sweden in total deaths per capita. And I think what's most important is looking at what countries did well rather than what countries failed. There's a lot of different ways to fail, and there's also a lot of different ways to do well. But to look at Sweden like it's some success story is really mind-boggling to me. A lot of people that back up this idea will say like, oh, just you wait until the end of the pandemic, all those curves are going to go back up and Sweden's going to win in the long run. And it just doesn't seem to be a convincing case. Pretty much every country did really horribly at protecting their long-term care facilities, like nursing homes. A lot of the deaths come from those facilities. Like in the US, it's something close to 40–50%. Sweden also messed that up. Yeah. So I think the main story is Sweden did bad, so did a lot of other countries, and a lot of, like, a few dozen other countries did really well and have barely any cases now.
Yeah, and this is sort of a lives versus economy argument, and from my understanding, Sweden's economy did not do noticeably better than its neighbors. Like, there's maybe 2% versus 5% downturn or something, or like 4% versus 6% downturn, or 8% versus, it's not like the one economic shining star. And there's a couple reasons for this. One is people don't want to get sick, and so every in-person economic transaction has a COVID tax of, if I buy this thing, I have to go to the store, and if I go to the store, I risk getting sick, and if I risk getting sick, then I have a probability of losing out on work, and then that's an economic cost that goes directly to me, plus the medical cost, plus the suffering and possible permanent damage, which may leave me disabled. And people account for all of that, maybe not highly intentionally, but with some degree of awareness when they make decisions. And so nobody's going to actually go out during a pandemic, not for long periods of time. And that really is an economic burden that we can't avoid with policy, or a lack of awareness of the disease, because people figure it out on their own. It's not like we have inbuilt psychological response to pandemic, and for the most part, either you're completely blind to the risk, or you account for the risk, and that's sort of a is a psychological response. But beyond that, so much of economics is export-import, and when there's a global pandemic, all of these things create feedback loops with each other, and there is a massive economic slowdown because it's difficult to do exchange when every exchange comes with the COVID tax.
A quick question, Derrick. I wanted to follow up on the countries that are doing well, and the economy. Have there been, I haven't seen that much out of the countries that are doing well comparing how their economies are doing with their COVID response. And I think that's really powerful understanding to be looking where things are going right. It really resonated for me months ago when they were like, the Apple stores reopened in China, and it was just like, yeah, they took care of the disease and everything went right back to normal in most of the entire country. So I just think that's a kind of interesting missing from the conversation because there is so much focus on the places that are doing poorly.
I think this is where it starts.
Yeah, so as for it's really not just COVID that's the issue here. Like,
economic decline.
It's probably the main issue at the moment. So here I have a web page open from Our World in Data, that sort of talks about this a little bit. So let's see, on the y-axis we have confirmed deaths per million people, and so those are COVID deaths. And then on the left we have GDP growth from previous year. So let's see, you can just sort of check out which countries did well and which countries didn't. So this top top left will be sort of the worst performing in both metrics. They really had a large change, a large loss in GDP, and they had a large number of deaths. And so the countries that did really well in both are down here. And so you can see there's some correlation here. Like, and this means like, sort of, and this means the countries that tended to do bad in terms of like a bunch of people died from COVID, they also, that correlated with a GDP loss. And so the correlation here is not perfect, but you can sort of just eyeball it. It's sort of, this trend goes up and to the left. And so countries that are down here on the bottom right, Lithuania, Taiwan, South Korea, Indonesia, these countries have all done pretty well. US is up here. So I think the size of the circle here, I'd have to read the fine text. I think it talks about sort of the size of the economy. And so, yeah, you can compare different countries using both of these metrics in this plot. I'll put that link in the chat in case anybody wants to explore this graph.
Yeah, that's a very interesting visualization. And I think what really makes the strong case is that there's only one country that's underneath that axis, Tunisia. So you can see like the correlation axis, and then there's some economies that have managed to like take a heavy hit in terms of COVID without taking a massive hit in terms of economy, like Belgium and the US being kind of like two examples there. But there's only one very small country, which probably has a specific reason for it, in Tunisia, that had really low damage from COVID, but had a massive hit from the economy. Every other country, there's a strong correlation. Like the better you do in terms of COVID, the better your economy is doing, and the worse you're doing, the worse your economy is doing. Especially, but there's an empty quadrant on that graph, except for Tunisia, which it's entirely empty, at least on that graph. Where if you had a really good COVID response, your economy did not tank. And there's plenty of places where economy tanked in really strong correlation with damage from COVID. And I think that sells it more than like looking at the US and seeing the very bullheaded American market and being like, oh, that wasn't so bad. Or looking at Belgium and thinking, that wasn't so bad. In terms of economic perspective, I think that looking, oh, there's really nowhere that's been, good about COVID and taken a massive hit. I think that's like really the lesson from that graph. But that's a fantastic graph, Derrick. Thanks for sharing.
And one more thing, when you mentioned the cost of COVID, just want to mention the leading cause of death in the United States is heart disease in 2019. Second was cancer. And now in 2020, it will be either second or third, which is the COVID. And COVID could cause heart disease in children, so they might die of stroke or something. So, and then the cost of COVID, we haven't seen that this will come around, it's lagged, which will be the mental illness from being home and, not being to losing job, no money to, the food chain has been broken. So mental health and domestic violence is happening. Food scarcity is a big one. And PSTD, what is called the post-traumatic stress, that is going to come in 2 years. So not only economic, but also the well-being of a person. And the food chain is big importance. Thank you. Yeah, go ahead.
If you mess up COVID, it's not just people die. It's you have substantial population morbidity where these basically every infection has some probability that we don't really know of causing some long-term damage, potentially. We know COVID gets into like the heart, the brain, the lungs, kidneys, all sorts of organs all throughout the body. And there are like biological reasons for that, which I'm not an expert on. But there's some data coming out about that. and they're not coming out with small percentages. Yeah, the population morbidity after getting COVID is probably going to be high. And then you have all sorts of things like the lockdown's not helping people's mental health, like education's taking a hit,
Yes.
economy's taking a hit, people are losing their jobs, losing their homes. If you mess up COVID, you're really messing up a lot.
So it has to be control, and education is a big part of it. Like, telling people how to wear the mask the right way or use the mask. So the local, at the grassroots level.
Yeah, and I think our basic position on ECV is just like throw everything you can at COVID really hard and get rid of it as fast as you can, and then open up slowly. And there's countries that did that, like Australia is taking really drastic measures right now after an outbreak, and it's going away. And if you get down to zero, you can just live basically normal life. You'll keep track of what's coming across the border, and if outbreaks pop up, you sort of jump on them and stamp them out really quickly. And yeah, for the most part, you can live like normal if you play your cards right.
So kind of, you jump on it, you get it out, you get it done. I think open up slowly is not quite the right wording. Open up carefully is probably a better wording. You can get back to full functioning relatively quickly if you have good watchman measures in place.
Yeah,
Like
controls in place, right?
If you can micro quarantine effectively, and you have contact tracing, which people are talking about, the masks didn't work, or this didn't work, or that didn't work, and this is kind of a weird thing because it's like, a 5% return plus another 5% return plus another 5% return is 15% return. And if you're trying to go from, like a spread in the population, which is like 1.2, and, you get that under 1, like, it's small returns cumulatively make a huge difference. And if you're missing keystone pieces like contact tracing, it's very difficult to actually have success, extinguishing the virus. It's like if you imagine you're trying to put out a fire, and there's just cinders going up in the smoke, and those are landing and starting new fires. That's what untraced disease spread is. And if you put some way of ensuring that those cinders go out before they reach the ground, you have a much better chance of actually containing the fire with a perimeter.
The COVID testing also, contact tracing, as well as vaccine planning.
And so
can we get out of the woods?
So I think kind of the last topic we should go into is, I think, well summed up here in the chat as the cure is worse than the disease. And like, that is the counter perspective for a lot of what is going on. And I don't think that we can get entirely into that like position and frame of argument in this talk. But I think that, this is, fundamentally kind of the fight that is going on right now, is whether the cure is worse than the disease. Like, it's been almost a year of COVID from like the first known case till now, and a lot has happened.
So it has been 9 months. It's a gestational period. Now we'll see the real giant COVID coming with the second wave.
But it has disrupted every aspect of daily life for most people in the technologically connected world, at the very least. And we've seen, like, I don't know if there's any place let me frame it this way. The cure is worse than the disease. Is there any place that has done well and just not cared about COVID? No, there have been places that have not been affected by COVID very drastically, oftentimes because they have a high population health due to the plague of modernity problems, like poorer places which have more active lifestyles, that are more outdoors, that have more local food, and don't have standard American diet, for example, are doing better for the most part, not in totality, because the disease does not affect them as badly because they're healthier, and less obesity, less chronic fatigue, less of the list of problems of modernity. And so places like that have like Africa, for example, has handled COVID surprisingly well so far, for the most part. And I think a lot of that is that the populations there are healthier. They're not they're not necessarily well fed by our standards across the board, but a lot of African nations are surprisingly modern. They're still highly rural,
Yeah.
but they are, for the most part, modern. They have roads, they have medicine, they have relatively well governed, and most of the people there have a healthy lifestyle and healthy diet, living closer to nature than we do. And this has had a significant impact on how COVID has affected them. And so they haven't been damaged, despite perhaps
And
not
they
being
do
able
a
to
lot of physical activity, walking many miles. Those are good. In life here is more sedentary.
Yeah, and so because these nations have a different population health state than we do, they've been able to, they may not have had the best response. Maybe they've had a good response. I don't track it that closely, but COVID hasn't been catastrophic for them. Whereas if you look at any place where COVID has had a high impact in terms of spread or in terms of death rate, those places have low health and haven't handled the COVID crisis well. There isn't anywhere that's been like, oh, COVID, pshaw, we'll just let that burn through a population and we'll be fine. That has not happened anywhere. So the claim that the cure is worse than a disease is ignoring that the disease is bad and does bad things, and not like the cure in terms of like policy is not worse than a disease, because the impact of the disease on the social environment, like what people do every day, is not lockdowns. Okay, now I take care of myself from the virus. It's, oh, there's a virus, I need to take care of myself. Sweet, this lockdown allows us to perform collective action in a way that gives us a higher probability of beating the disease and doing less damage. It's, it's the best shot. And if you take your best shot and miss, it's going to suck. But not taking your best shot and, just getting, full bore against yourself from the disease is not going well for anybody. Sort of the tepid nations like the UK and the US have really gotten the worst of COVID. Like places that have taken a more serious approach have done better. They may not have done like well in some kind of, highly sophisticated standard, like, oh, they're completely free of disease and nobody died. But if you look at the places that have been more proactive across the board, they're looking better than we are. So I think our cure has failed is not the cure is worse than a disease. It is, we had a really shitty cure to start with. And so blaming a shitty cure on all potential cure models is a bad faith move. And we need to get sophisticated about how to actually stop the virus, which is what we are here at ECV trying to do.
And one observation, when you look at developed countries, it's the poor people, disadvantaged, are dying. But this is a question I got from India as we look into depth on Indian data. It's not the people in the slums of Mumbai or the migrant workers there. They're not dying. It's the middle class that are dying. And that answers the questions you had, Middle class has a very sedentary life, emerging markets, they eat a lot of fried food, McDonald's, everything is there. in India, but the poor people or the disadvantaged population, which is 70% of India's population, they are okay because they only get to eat like rice and a bowl of, lentil and walk a lot. So socio-economic thing is kind of turned around. Most of the deaths are in middle and high middle class in India.
Yeah, it's population health in the Western developed nations is this different than population health in like second world nations. Yeah. Derrick, do you have some final thoughts? We're sort of getting close to the daily call here.
I think in the last few minutes, there was a lot I agree with, but there was also a lot I don't think is true. But I think maybe a couple of things to just point out. One that is that age seems to be, if you look at the infection fatality rate, that's the probability that you're going to die if you get infected. If you look at it as a function of age, it sort of goes up exponentially. And so if you have a population that's really top heavy, that has a lot of old people, that population is not going to fare well if COVID gets into that age group. And it turns out once COVID gets into that region, it's really difficult to keep it away from that age group. And then the other thing is, I'll second what Shakuntala was saying. Basically everywhere around the world, well, maybe not everywhere. It's hard to generalize with COVID. The outcomes are so heterogeneous that it's tough to generalize. But at least in the US, the people that are getting hit the hardest are the poorest families. And so if your motivation is to sort of help out those that are sort of the most unlucky, you really want to contain COVID.
And especially in the metropolitan statistical area like South Chicago, Harlem, everywhere, Bronx, Brooklyn.
Yeah,
so 2020 hasn't been a good year. I don't know, maybe till 21 we have to be very cautious about everything.
Yeah, we'll see how it goes. If 2021 is worse than 2020, we've got some troubles ahead.
Mm-hmm.
Yeah. All right. Well, thank you, Derrick and Shakuntala, for coming on and talking data science. I'd like to go into more of how data science works behind the scenes and more on how data science relates to COVID in the near future.
Okay.
As I think this is an important topic, and we've only brushed the surface in the hour that we had.
Okay.
And it's also a very sophisticated
machine
topic.
learning. We'll show a machine learning algorithm, maybe on supply chain for
possibly,
cooking.
yeah. There's a lot to talk about.
Thing.
We'll plan it. We'll plan it out, and of course, as always,
in
thanks
October.
to Anjum. Thanks for Anjum for running our behind the scenes, and thanks to all of you here on the call for giving us your time to listen, and then thanks to everybody out on the net watching the recording. Take care, stay safe, and be smart.
Thank
Bye-bye.
you, Dio, for moderating. Thank you, Anjum, for picking us to talk today. And Derrick, very nice, partner in crime on data science. So we'll do more.
Thanks. You're not too bad yourself, Shakuntala.
Okay, thank you. We'll do a model comparing US and India, and it'll be machine learning algorithm.
Sounds fun.
Okay, thank you.
You
Anybody has any question, you can send it later. We can answer it. Thanks for the opportunity.
We've got the channel Ask an Expert channel on the Slack. So yeah, we could have a thread in there on data science. That might be really interesting. All right. Bye, everyone.
Thank you.